Today, we're going to talk about this chart. So when you realize that you want to optimize your vision through cataract or lens replacement surgery, how do you choose the lens that's going to help you see your best for the rest of your life? We're going to help you answer that question in this video. You'll need to answer 3 questions about your visual goals in order to make that decision. Or, as I like to say, you'll need to begin with the end in mind. Question number 1, do you want to wear glasses most of the time to see your best near, mid, and far? Question number 2, do you want to see your best near, mid, and far away without having to rely on glasses most of the time? And question number 3, are you willing to pay out of pocket to reduce or eliminate your reliance on glasses to see your best near, mid, and far? First, a reality check. If you truly want to know which lens implant will work best for you, then you need to speak with your eye surgeon in person after they have examined your eyes and performed an array of diagnostic tests to understand the health and anatomy of your eyes. For our patients, we discuss this chart with them, and it's on our website at austineye.com if you want to review it. And we do update it periodically when we transition from older lenses to newer lenses that we find to be more effective. There are 4 options listed, but in reality, we recommend you select from 3 of these options. Option 1, your goal is to see near, mid, and far away without glasses. If this is your goal, then we recommend the NV multifocal. It gives great vision to read your cell phone, see your computer or your dashboard, see your TV, and drive without glasses. Vision with the NV multifocal is clear from about 16 inches from your eye and beyond. And there is a mild halo that patients will see around lights at night. But thus far, in my experience, using the NV multifocal for the past year and a half in over 1,100 patients, only about 0.5% of patients are significantly bothered with the NV multifocal by the halos that they see around lights at night. In other words, there's a 99.5% chance that if you see the halo through the NV multifocal around lights at night, the halo effect is not that bothersome. If having a halo effect around lights at night is a deal breaker for you, then the puresee lens is an excellent option. The puresee lens gives great vision far and mid-range, so you can see your dashboard and your desktop computer. You can drive. You won't see much of a halo around lights at night. However, with the puresee, the near vision is not as strong as it would be with the NV multifocal. Patients with a puresee lens, in order to read their cell phone or read documents, you'll need to use 1.5 over-the-counter reading glasses to see near, but you won't need glasses to see mid or far with the puresee. Option number 2, your goal is to see clearly far away without having to rely on glasses. You want to watch TV, drive, play sports like tennis or golf, and see fine far away. You don't mind wearing glasses for mid-range and near, and you know that you have some astigmatism that causes you to see blurry at all distances without glasses. Then the astigmatism-correcting monofocal lens that we use is the envista Aspire toric lens, and it gives great vision far away to drive. The night vision is excellent. There's minimal to no halo, but patients with an astigmatism-correcting monofocal, such as the envista toric Aspire, will need glasses to see the computer or to read their phone or read documents. Option number 3, you want to see clearly and you don't mind wearing glasses full time to see your very best. You don't want to pay extra out of pocket for lenses that reduce or eliminate your reliance on glasses. You want the lens that's covered by insurance and has the lowest out-of-pocket expense. Then basic cataract surgery with a monofocal lens is the best choice for you. The monofocal lens that we prefer is the Bausch & Lomb LI61 AO monofocal lens. Patients see great with it. They see great day and night, but they need glasses full time to see their best. Now, there is a fourth option, the light adjustable lens. It's a monofocal lens designed to be adjustable by your surgeon using this light delivery device after it's implanted. We started using the light adjustable lens in 2023. We have not had great success with this lens over the past few years. We rarely use the light adjustable lens in 2026 in our practice. I actually remove more light adjustable lenses in 2026 from patients who come to see me who receive the light adjustable lens from other practices, and they're unhappy with their vision and they want the light adjustable lens removed. So unless this technology improves, we don't recommend it presently. Now let me go through a quick lightning round of some common scenarios we encounter in patients that come to see us wanting cataract or lens replacement surgery. If you've had LASIK surgery, are you a good candidate for a multifocal lens? Yes, about 25% of the patients who we place the NV multifocal lens into have had prior LASIK surgery, and in general, these patients see great. What's the best lens to help patients who've had prior radial keratotomy surgery see their best with the least reliance on glasses? The new puresee lens seems to work great. Again, it gives great far and mid-range vision without glasses. Patients still need to use weak 1.5 reading glasses, but the night vision is outstanding. How much does all this cost to me as a patient? If you have a visually significant cataract and you have medical insurance, then your costs are listed here. If you have a visually insignificant cataract or you're paying out of pocket because your surgery is considered elective, then your costs are shown here. Let me emphasize that it is impossible for me to know which lens is best for you unless I or your eye surgeon examines your eyes in person in the office and discusses the pros and cons, strengths and weaknesses, and costs of the various lens options with you. We can't do it via email, and we can't answer your questions specific to you through the comment section below. This video hopefully gives you an introduction to help you begin to make that final decision. Finally, let me give you a brief update on what we believe are the best lenses on the market as of May 2026. In 2025 until early May 2026, we offered these lenses for our patients. However, after using these lenses extensively and based on our patients' experience and outcomes with these various lenses, we stopped using some lenses and transitioned to using the lenses that had the highest satisfaction rate and the lowest dissatisfaction rate for our patients. Hey, thanks for watching as always. Hope this video was helpful. See you on the next one. Bye-bye.